You most likely know someone who's been affected by mental illness. And the question going through your mind is, why him? Or why her? Or maybe you've been affected in some way yourself and you're wondering, well, what's going on here? Why has this happened to me? So, what is it that causes mental illness? Is it drugs? Is it substance misuse? Drugs and alcohol? Is it stress? Is it a head injury? Is it because somebody else in the family has a mental illness? Is it relationship difficulties? What is it that causes mental illness? Is it a curse? Is it physical illness that leads to mental illness? Questions. Now, you will hear the professionals saying mental illness is caused by a combination of genetic and environmental factors, a complex interplay between genes and environment. And you know what? They are right. Mental illness is caused by a number of factors. There's no one single cause. The greater the number of these factors present, or the more intense they are, the more likely it is to lead to a mental illness. So let's put it this way. There are predisposing or vulnerability factors, and then there are trigger factors for mental illness. So predisposing factors and then trigger factors. The predisposing factors are what the professionals call genetic factors. So there could be a family history of mental illness, which means someone on the paternal or maternal side has experienced mental illness in the past, which makes it more likely for someone else in the family then to experience mental illness. But that doesn't mean they will certainly develop it. It just renders them vulnerable. But when you take that vulnerability factor and you add to it a trigger, the trigger sort of ignites the mental illness. So trigger factors are things like stress, stress from work, stress from academics, stress from debt, financial debt, relationship difficulties, a lack of accommodation, those kinds of stressors. And then you have things like drugs and alcohol. Cannabis plays a big role. Cocaine, street drugs, they all are trigger factors for mental illness. So you have a combination of a predisposing factor or a vulnerability factor and then stress coming together. Now, the fact is, not everyone who has a family history of mental illness will develop one. Not everyone who is exposed to stresses will develop a mental illness. But a combination of these factors is a potential reason why people could develop a mental illness. And that's, going back to what the professionals say, it's a complex interplay between genes and environmental factors. So that's why people develop mental illness. Now, the good news is that there is hope. There really is hope. There are treatments available for mental illness, and people should not shy away from seeking professional help. There is really a lot of help available. And please don't feel that help means automatically that you would be admitted to a mental health hospital. No, there are a whole range of options, and actually the sooner help is sought, the better. Okay, I'm Dr. Leah. I am the Riscovery Doctor. I specialize in turning mental health risk into recovery. Have a safe today and a sound tomorrow.